Good afternoon. Welcome to this contact webinar. If there's a technical hitch, do bear with us. Those of you that are joining by PC, laptop, tablet or smartphone should now be able to see this introduction slide. Because we've got so many attendees today, you'll all remain muted throughout. If you want to ask a question, use the question icon on the GoToWebinar toolbar at the bottom of your screen, and that will allow you to type in a question and submit to the webinar administrator, who will then pass it on to me. I'm planning the webinar in 4 sections this afternoon, and I'm going to prompt you and just remind you to ask for any questions or clarifications at the end of each section. I'll try to answer as many questions as I can as they come in, but if I miss any, I'll answer as many as I can at the end. Any questions that don't get answered or I don't know the answer to, we will provide a Q&A document which will get uploaded along with the recording of this webinar, details of which will circulate next week. And at the end of the webinar, there'll be a short questionnaire if you can take the time to complete this, because it helps us with future training events. So, hello, I'm Contact Strategic Health Lead. My name's Lynn Hoppenbrowers. For those of you that don't know me, my background is in nursing. For 20 odd years, I was a registered nurse within the NHS, mostly within adult care and in the latter years in the community. I was also a founding member of my local parent carer forum and was the parent participation worker manager for about 4 years before coming to Contact as their strategic health lead. And I'm still involved in my local forum as a steering group member. So nice to see everybody. This is an overview of what I'm going to talk about this afternoon. These are the 4 sections. So firstly, I'm going to talk about what my role is and how I can support your engagement with health. Then we're going to move on to look at some of the resources that are already available on Contact's website. Then we're going to have a look at some other good organisations and websites that might be useful to you as a forum and help you engage with your local health partners. And finally, I'm going to look at have a brief look at some of the national organisations that I'm involved in and how that involvement helps and supports forums engaging with health. So my role and how I might be able to help you. So I've been in post with Contact for about 2 years now. The main part of my role is working with the parent care participation team to support forums to engage with health. It has developed over time, and there are some changes to there have been some changes to my role over time, which I'll tell you about in a minute. But broadly, my role is about supporting you to engage with health, supporting the parent care participation advisors to support you, providing briefings, fact sheets on any health related subjects. And I'm a bit of a legislation nerd, I think is probably the best way of saying it. I'm always on the lookout for any changes to national policy, services, practice, anything that might affect children with disabilities that forums might need to know about. And back to the development of my role, something that we've started doing this year is what we're calling targeted support. Basically, that means working directly with forums or groups of forums to try and support your individual engagement with health. And I'll explain a little bit as I go on about why that's come about. So, how I can help you. I'm going to talk about these a bit more in depth on the next few slides, but just briefly, ways that I can help you engage with health are around understanding the NHS and who's who, understanding about the NHS's duty to involve and what that means to you, and also about helping identify, excuse me, would happen now, wouldn't it? Who you need to engage with on a specific issue. what your health issues are and who you might need to engage with. Also, it will be around helping you understand your local health networks. The NHS is an enormous organisation and the local health networks are very different. So actually finding some way of unpicking all of that might help. And also building on your existing engagement if you have some good engagement and good contacts with some people in health. So moving on to understanding the NHS. Even for those people that work within or alongside the NHS, it can be ridiculously confusing and made worse by the fact that the NHS loves its acronyms and abbreviations. So some of my role is about unpicking who's who, what all the different roles are, who all the different organisations are and what they do. Don't panic if you see some of those terms on the screen at the moment and you don't know what they are. You're not alone. And I'm only putting them there just as examples of some of those areas that you may or may not know about. For those of you that want to get a bit of an idea of just how complex the NHS is, if you haven't already seen it, the King's Fund animation is a really good, I think it's about 5-minute animation that tries to explain the NHS. It is enormously complex. When this presentation gets uploaded onto our website, there is a link in there, but otherwise, if you want to have a look today or sooner, if you were to Google or any other search engine, King's Fund NHS animation, you will find it. The NHS's duty to involve. When the Children and Families Act came out, I can remember having a number of conversations around the Section 19 principles and why they didn't apply to the NHS. This is why. The NHS Constitution. The NHS Constitution has been around for quite a while, and it was strengthened back in 2012 with the Health and Social Care Act, which is what brought in CCGs, clinical commissioning groups. And this is where the duty to involve comes from. If you're familiar with the terms individual and strategic participation, you can see that the two are reflected here. Basically, what the NHS Constitution says is you have a right to be involved in the planning and decision making around your health and care or your child's, but also you have the right to be involved directly or through representatives in the planning of healthcare services. So that's the strategic bit. And it's the bit around directly or through representatives. The through representatives, that's where forums come in. You are those representatives. But I think broadly, and it's getting better, the NHS has chosen to involve people directly. So they tends to be more around individual patient representatives rather than representative groups, which I think is some of the reasons why forums have struggled to engage with health organisations, because the way that they meet that duty to involve doesn't involve representative groups. I'm going to talk a little bit around how I can help you identify the health issues and give you a few hints and tips whilst we're going through here as well. A question that I often ask is, how do you know what the issues are? And what I mean by that is, where does the information you have come from and how do you prove it? The NHS is an organisation that is driven by evidence, research and best practice. Most decisions are based on what the research says is effective or not. And when I was a nurse, I always had to be prepared to be able to provide a rationale or proof for why I had either done something or not done something. It's all about proving a case. And you need to be able to present the evidence of what you are saying. So, for example, you've collected lots of parent feedback at your coffee morning on, let's say, speech and language therapy, because pretty much everybody says that speech and language therapy is an issue. How do you actually make that into evidence? The things that you can do that makes that then prove what you're saying is basically, rather than just saying this is what our parents are telling us, you need to provide something that, where does the information come from? Well, it came from X amount of coffee mornings over this period of time. It comes from X number of parents, and X number of parents all said this. It's about building up those levels of evidence, and it's just proving what you're saying. You know that what you're saying is true, but it's just about proving where that information comes from and how you've got it. It can also be useful to ask the same question. Something that I often suggest is asking about something along the lines of, what are the 3 things that you'd like to improve? What are the 3 services that you'd like to improve? If you keep asking that same question over time, you're then building up that evidence again over time, and you'll be able to, again, keep a log of where you're getting that evidence from, how many people it's from, where you got it from, and it builds up your evidence base over time. It will give you a good amount of evidence. And also within the NHS generally, what gets counted gets done. If you're able to find out whether something is a local priority, or it's something that any one of the organisations locally are working on and is being measured in some way, that will give you more chance of getting involved in what's happening. It's been a bit difficult over the last few years because children generally haven't been a priority for the NHS. So it's been really difficult for forums when trying to engage with health organisations around children's services, and particularly special educational needs and disability services, when they're being asked to do all of these other things that they're getting measured on and getting counted on to actually prioritise the children's care. I'm going to talk a little bit about the quality standards and guidance later, so I've skipped over that one if you noticed. Understanding your local health networks. There's a huge amount of transformation going on at the moment. And the NHS seems to love its transformation plans. But you may be aware of some of those transformations. You may not have heard of any of them. But again, they're just there for some examples. And as is the case with a lot of areas where forums work, even within the NHS, they're not particularly joined up. There's a lot of change going on with things like hospital mergers, clinical commissioning group mergers. And to add to this complexity, NHS regions are not the same as local authority regions. They're completely different, which can make it even more difficult to understand who you need to talk to, where they work, where they're based. And it just adds an extra layer of complexity. And the arrangements are different in every particular area. I'm not an expert in every local area, but what I can do is help you to unpick some of those networks in your area and perhaps pick out those specific people that might be the ones to approach and try and engage with. As with anything in engagement, it's often about finding the right person. And if you're lucky enough to have a good relationship with somebody already, then we can look at ways to build on that and maybe expand that. Generally, when I've been speaking to forums, they may well have a connection with one organisation, maybe a hospital or a community provider, or a CCG, a clinical commissioning group, but rarely do forums have good connections with all of the health organisations in the area. And something that we may need to be thinking around in the future is whether or not we try to engage with the NHS regionally or area wide, such as the STPs, again, Sustainability and Transformation Partnerships. If you don't know what they mean, I wouldn't unduly worry at the moment, because I don't think sustainability and transformation partnerships are very good at recognising that children come into their planning yet, let alone children with SEND. So I'm not actually sure that STPs are quite ready for forums, but it's something that I'm working on. How do we actually do that? Because moving forward, these partnerships that may or may not cover bigger areas than you are working, they may also go across different regions that you're working in. But ultimately, these are the plans and partnerships that are going to be driving a lot of the changes within the NHS going forward. So it's definitely something that I think forums can get involved in and have a lot to offer, but we haven't quite figured out how that works just yet. Something I'm working on. Okay, so that's the end of the first section. Any questions? Any clarification that you need about anything that I've said there? Send your questions in. I will try and answer them as I go along. Excuse me. But if you've got any questions at the moment, do send them in and I'll try and get on. There you go. There's a question just popped in right at the moment. So let me just work with my technology and open that. Okay, so question from Kathy about where can we find the structure and who's who in our local area. Now, Kathy, can I pause that, because I will answer that question a little bit further on. So come back to me if I haven't fully answered it, but I think I'm going to answer that one as we move through. Okay, so moving on to what help we've got available already. And now my technology is not working. There we go. Okay, our improving web health services web pages. These are within the parent care participation web pages on the Contact website. And I've been working on these over the last few months and done a little bit of refreshing and tidying up. So I'm going to take you through a bit more in depth about what is available, but there you can see some of the basics about what is available on the website as a whole. So I've just done a screenshot for you there so you can see where you can find these pages. I hope that makes sense. I know it's quite small, but it's more to give you an idea of what you're looking at. This page has some links to the introductory information about the NHS, links to Contact's general pages around the NHS, and there's a briefing there that I did around introducing some of the main players within the NHS, the main organisations, and it also has a briefing on the NHS 5-year forward view. If you haven't heard of that, don't worry. It's the NHS's Strategic Improvement Plan, which was published in 2014. Some of you may remember announcements linked to extra money for the NHS in the summer, linked to it being 70 years old. This extra money that the NHS is getting, hopefully, fingers crossed, the government has asked the NHS to write another plan. And if you're good at maths, you'll have noticed that a 5-year plan, it started in 2014, it's going to finish next year. So the government is basically asking the NHS to write a 10-year plan now. They've only been given a window of about 3 months or something, ridiculously tiny, in order to write this plan. There is currently a consultation open on the 10-year plan, but you would have to be quick in order to get your views in because it closes this Sunday. But I'm putting together a Contact response, and I know that the National Network of Parent Care Forums is also putting in a response. So the forum perspective will be included within there. Okay, so back to the web pages. Another page that I've added recently is a news and updates page. What I was finding is that some of the information that comes my way is time sensitive. So things like consultations, like the 10-year plan consultation, workshops that I might find out about, or even some of those requests for participation. Like I was saying earlier around, the NHS does like to have individuals represented rather than groups represented. But some of those things, particularly if you have an interest in an area, they might be, it might be a way of you getting to know the NHS more and finding out and being involved in some of those decision making. So really what I needed is some way to get that information out to forums that actually worked, that worked within the timescales that they were giving me. So what I'm intending to do with this, the page is already there, there's already some information on it. I'm planning to regularly update it with anything that comes across my desk, but also if you find out about anything that's useful to you, send it on to me so that I can then share it with other forums as well, so that we can just start getting a bit better sharing all this information, because there is often a lot of information out there that we find out by accident. The resources page is basically that. It's got lots of resources. There's no nice writing or anything. It is basically, there's lots of publications that will be useful to you. There are some that will help you understand the NHS a little bit better, how you might engage with the NHS a bit better. There's a couple that are particularly useful around engaging with your CCG. There's guidance from NHS England around how CCGs should engage. And there's two documents, one for around the strategic engagement, so the engagement with groups and patient representatives, but there's also a bit about engaging with individual patients around their own health and care. The GP resources are quite useful, although they are a little bit old now, but they're still relevant. And this is again something that I've been trying to work on. Engaging with GPs can be a little bit difficult, because although GPs are NHS, they're essentially all separate businesses, and it's actually quite difficult to engage with them all as a whole. So short of a forum going and knocking on every individual GP surgery in your area, it's very difficult to actually find those routes to engage with them as a whole. I'm working on something with NHS England that may well give us some of those routes into GPs that we haven't had before now. So hopefully I might have something to share with you in the future. Watch this space. There's also some good examples on there about working with hospitals and developing passports for particular illnesses, particular admissions and things like that. And there's also some examples and some surveys and things that you can adapt for your own use around collecting evidence and feedback. Again, we go back to the evidence and feedback again. And of course, webinars. I've put all of the health related webinars are all in the one place. They may well be replicated elsewhere on the pages, but in order to make sure that we've got all the health resources all in one place, they're all on those pages too. And that's where this one will be uploaded once we've done the recording. If you haven't already seen the Engaging with Health Partners Toolkit, I'd urge you to go and have a look. It's a really useful document. Some of you may remember that Contact, along with NHS England, National Network and DFE, run a pilot around engaging with health partners in 2015-16, and this document is basically the learning from that. And it breaks down some of the key players in health, and it guides you through how to find local information and developing your action plans around your engagement with health. And back to Kathy and your question, I think this may answer some of your questions. It gives you those prompts and looks at where you might find that information, where you might find out what your local plans are, what your local area's priorities are, and who those people are as well. In addition to the document, there is a webinar again, but in addition to taking you through some of the information that's in the document, there's also some feedback from one of the forums that was involved in the pilot and some of their learning that they found along the way. And if you need a little bit more support and are in a position to purchase an additional workshop, there is a workshop that it complements both the webinar and the document, and that's where you can get that face-to-face working and action planning around looking at your health landscape and working out what are your priorities within health. If you're interested in that workshop, you can either get in touch with me or you can talk to your parent care participation advisor about it. They can be paid for out of your grant or a discretionary grant. And if when you look through that document you think, actually, this is too much for me, I don't understand any of it, something that I developed whilst I've been in my role is a more basic introduction workshop. This is much more about unpicking the who's who the organisations are, what their role is, and understanding some of that jargon and all of the abbreviations that you find in the NHS. This again is one that can be purchased by forums. If you have any questions, then just ask either me or your parent care participation advisor. So that's the end of what's available from Contact. Any other questions? Let me just double check and see whether I've got any questions. Yep. What is an STP? I seem to miss that bit. Thank you, Sue. Sustainability and Transformation Partnership. It started off as a Sustainability and Transformation Plan. It's now developed into a partnership, and what it basically is there are groups of organisations and groups of areas that now have to work together to plan how they are going to make all these changes in the NHS. If you've heard anything around hospital closures, or any of the news stories are generally related to the sustainability and transformation partnerships. And Kate says, do you suggest we try and engage with STPs? Depends on your area. If you've got somebody within your sustainability and transformation partnership that you have a good relationship with, I would suggest trying to get involved. But like I said before, I don't think they're not terribly aware of children yet. So they're definitely not aware of children with disabilities. And I think it's something that is going to have to be worked on nationally. Let me just have a look at other questions. Will sensory integration therapy be asked for in your 10-year plan submission, Kate? I think it comes into it. I can't remember off the top of my head, but it is one of those things that comes into it. And again, we'll probably talk a little about these therapies and things a bit later on. It's something that is becoming, I'm hearing more and more local, both locally, regionally and nationally. It's something that a lot of forums are asking for and a lot of areas don't do. And I think one of the problems with this is, we'll come back, is that evidence. And it's one of those problematic areas where there isn't actually a great deal of evidence that it works, but is that because there just hasn't been research into whether it works? And that is a big problem. Kate, another question from you around clarity around autism mental health. Yeah, absolutely. That is definitely part of our response to the 10-year plan, and there is already going to be a clinical priority, so one of those priorities around learning disabilities, autism, and or both. So there's already definitely going to be something around that in it. And Kathy, again, toolkit, it is absolutely available on the website, and what I'll do is I'll make sure there is a link to the toolkit either in the presentation or on the Q&A document that we develop whilst we're uploading this. Okay, back to the presentation. Other sources of useful information. So the next couple of slides are about signposting to some websites that I particularly find useful and are good at finding that evidence and best practice that in order to work well with the NHS you need. I'm just going to quickly run through some of these and just explain what they are and who they are. The King's Fund, I mentioned right at the beginning with their animation. They are an independent charity and their website is huge. But it is a really good place to start if you want to understand the NHS a little bit better and understand all the changes that are going on in the NHS. If you hear something at a health meeting that you don't understand, or you hear a term that you don't understand, the chances are you'll find an explanation about it on the King's Fund. They also have quite a lot of evaluation of what's happening in the NHS, and because they're independent, it is a very open and honest evaluation of what's happening, and they do lots of blogs and opinion pieces as well, so it's a really good way of getting an unbiased view of all of the changes that are happening within the NHS, whether they're good, bad or indifferent. So the King, I would highly recommend, but you could get lost. It is a rabbit hole. There is an enormous amount of information on there. So pick your bits that you're going to look at. You're probably already aware of the Council for Disabled Children and their website. They have lots of health related resources, but one that I particularly want to point you to at the moment is something that they're developing called Joining the Dots. This is basically come out of this arena where there's loads of these transformation plans going on at the moment. We've got the SEND, we've got Transforming Care, we've got mental health, we've got personal health budgets, and the list goes on. And all of them seem to be being worked on in isolation. But actually a lot of them overlaps hugely, and that's the intention of this Joining the Dots page. It's about showing how actually we're talking about the same kind of work. There a lot of what we're doing is the same stuff. We should just be doing it together, and we might actually achieve a bit more because we're pulling it all together. So that's another good website. I think that's being developed a bit more over the coming months, so keep an eye on that one. NICE at the bottom, another huge website, but a really important one. It's National Institute of Health and Care Excellence. NICE basically produce all of those clinical guidelines and standards that the NHS should follow. Generally, if there are debates about whether or not a treatment should be funded or not, it's NICE that makes that decision. Everything that they produce is completely evidence-based. It's about looking at the research, looking at the research as to whether something works or doesn't work. I think cost efficiencies come into their decisions as well, whether or not something works but is hugely expensive. So they are a really good website to look at, to make sure that whether or not your area is actually doing what NICE say. They also have a an evidence search on their website, which allows you to find some of those best practice examples. So you can put pretty much anything into their evidence search, and it will come up with lots of different research papers or any guidelines that they do, or any guidance that they do around that subject. So it's another easy way to try and find some of those best practice examples. Now, I've included the What Works website. This is from the Communication Trust, primarily because speech and language therapy is often a problem. The site itself is aimed at speech and language therapy practitioners, but it can be useful to see what evidence there is to back up particular therapies. However, one slight word of warning, it goes back to the question earlier. You might find that that some of the things that parent carers want, there isn't a great deal of evidence to back it up, which makes it much more difficult for you to ask for it. And again, it's not necessarily because it doesn't work. It might well be just because there hasn't been a great deal of research into whether it works or not. So the whole evidence-based, research-based does have its flaws, but it will certainly give you some help if there are particular therapies in there that say that are useful, but you're not getting in your local area. If you haven't already heard of Disability Matters, it's a really good site that has lots of free e-learning around anything disability. It was co-produced when it was developed, but the reason that I'm signposting to it now is actually it's a good way for forum steering group members to learn about other disabilities that they might not have experience of, but also because it's now hosted by Health Education England, it's a good one to signpost to your health colleagues. So it's the fact that it's free, doesn't cost anything. All it costs is time. You can say to your CCG or your hospital or your community provider, look at Disability Matters. If you want your staff to know about disability, look, it's free. It's a good thing for forums to know about and tell people about. And the fact that it's now hosted by Health Education England means that it's evidence-based. It has been proven to be evidence-based. It fits within what the NHS likes. And the last one is Easy Health. This one's more of a signposting. It's aimed at people with learning disabilities and includes lots of easy read information. There's lots of leaflets on there and lots of general health information in an easy read format. Now, if you're anything like me, I often go and read the easy read version first to get an idea of something and then go look for the proper document and read that as well for a bit more in depth. So it's both good for learning about a lot of things, but also for signposting. And I think it's one that not a lot of people are aware of. Okay, that feels like an awful lot of information in a short amount of time. I hope I haven't lost you yet. Any more questions? Keep sending them in. The next few slides are about some of the national organisations I'm involved in and basically what's the point for forums? How does that help forums? So the first one I want to talk about is the NHS England Children with Complex Needs Board. This is essentially the steering group within NHS England that oversees their responsibilities around special educational needs. For those of you that have come to national events or regional events, you might well have met Lorraine Mulrooney. She is the lead within NHS England for everything to do with children and young people with SEND. And she leads on this board. And kind of going back to the point of this is one major thing that came out of this board was the development of a network of regional leads within NHS England. Up to when this board was set up, and you'll see it was set up in 2015, which was already a year after the Children and Families Act came in, there wasn't a great deal of oversight from the NHS around what NHS local bodies are doing around the Children and Families Act, and this is what has driven that. The Children with Complex Needs Board has driven that oversight of what local areas are doing when it comes to the Children and Families Act. So we now have a network of regional leads, and again, because NHS have regions and local offices, then they don't bear any resemblance to local authority areas. So your regional lead might not be somebody that you necessarily work with. It might come from a neighbouring area. But there are all of these NHS England send leads out there. They know about parent carer forums, and they know that CCG should be engaging with parent carer forums. So they are another route for you to get that engagement that you want. They can talk to your CCG and strongly encourage them to engage with you. And also, for any of you that have had the Ofsted CQC inspections, the NHS regional leads will be involved in those feedback meetings, or if you're an area where you've got a written statement of action, NHS England send leads are the ones that will be going to those meetings as well. So they are there, it is working. Royal College of Paediatrics and Child Health, RCPCH. It took me a long time to get my tongue around that acronym. And they were an organisation that I didn't really know a great deal about until I came to contact. But they actually do an awful lot in child health. Now, because they are all children, it's not disability specific. They look at all children, but they also develop a number of standards and guidance, and they're involved in training of paediatricians and reviewing how child health is generally. Although paediatricians don't have to be a member, the majority are. And if paediatricians are a member, they need to work by the standards that the Royal College sets. So some of them that I've put the links on the slide there are the Facing the Future standards, and that's broken down into several different areas, and I think are emergency and urgent care, general paediatrics, and then long-term conditions, which is particularly where SEND fits. And the state of child health, that was a look at what children's health is like in the UK and how we compare to other countries, which came up with some recommendations about what the governments need to do about that. And then they went back a year later and actually said, well, what actually have we done? And there is considerable difference between the countries in the UK as to how well they're doing with child health. Another interesting thing that I knew nothing about was something that they do called invited reviews. They're essentially an Ofsted style review of service delivery. They can look at service changes, how well they're meeting the standards, looking at the workforce, how they can work better with other people, all of those things. The downside is they have to be invited, hence the name. But it's something that I think is useful for forums to be aware of, because there have been a lot of changes and service change to paediatric care over the last few years. And actually, if that's something that's maybe being suggested in your area, then you could suggest, why don't you have an invited review? It's basically a self-evaluation of how they're doing, and we'll come up with some recommendations of what they need to do. But the bottom line is it has to be requested by the person that's having the review. That's the difference. It's not it's not like Ofsted where they come in and review anyway. There's also a really active children and young people's engagement team at RCPCH. It's called And Us. and they do a lot of how to engage with children and young people, lots of practical tips and activities. I've put a link in the presentation to some of their activities, but they're really, really simple and obvious ways of engaging with children and young people, many of which can be translated into parent-carer engagement. So you might pick up some hints and tips about how do you get that feedback from your parent members, and how do you collect it. Next one is the British Academy of Childhood Disability, BACD, where the Royal College of Paediatrics is all children. The British Academy is disability specific, and the majority of the members of BACD are members of the Royal College of Paediatrics as well, but it also includes nursing, therapy professionals as well. They also develop guidance and policy advice around childhood disability. They're also involved in the training and monitoring of paediatricians and people that work within childhood disability. And they also do quite a lot around research. So again, it's where that best practice comes from. So what does this all mean for you, and how can you use it? I'm just on to my last few slides now. Timing's perfect, hopefully. So if you've got a question, send it over. David, I think I'll send a link to the cost of the workshops within the Q&A document, because I'm not entirely sure. So I will answer that one in the Q&A document. As is often the case with engagement, it's often about finding the right person, and health is no exception. And this is where I go back to those national organisations. Have you got anybody in your local area that's involved with those national organisations? Are they involved in BACD, the disability specific one? Are they involved in anything at the Royal College of Paediatrics? Do they belong to the Royal College of Paediatrics? Do they know about the standards, things like that? If you've got somebody locally who is one of these organisations, the chances are they're going to be an ally, because they already get it. They already know that they're wanting to do the best practice because they're involved in these national organisations. And with the NHS as well, sometimes you need to know their language. And what I've noticed is that the people within the NHS, and it follows with NHS England and with CCGs as well, that often the people that are responsible for special educational needs and disability, they seem to have quality or patient experience is another term that is becoming more common. So they're often people that have these job titles, so quality improvement, quality assurance, quality and experience. And the other thing is that what the NHS calls engagement is patient and public engagement. Now, there are lots of different ways that the NHS calls that participation. Sometimes you might see PPI, patient and public involvement, patient and public engagement. There are lots of different names for it, and it will depend on your local area. There's no consistency, basically. It will depend on your local area and what those different job titles are. And if you're really struggling, that's when I think you need to go to your regional SEND lead, because they should know about parent care forums and how parent care forums want to engage. And if you don't know your regional SEND lead already, speak to me or your parent care participation advisor. We can help. We can point you in the direction. I'm just going to flick forward and then check for any other questions. Kathy, does the Children with Complex Needs Board encompass all children with SEND, or is it only those at a specific level of severity, complexity? No, it is all children with SEND. I think, to be fair, there is a not a preference, no, there is a concentration on education, health and care plans, because and that is essentially what has been reflected around the country. There has been that we've been tied up with education, health and care plans, and we've forgotten about all the other children with SEND, and that is replicated locally. So there is that same replication within the Children with Complex Needs Board, but it essentially covers all children with SEND, not just those with an education, health and care plan. I'll look at other questions. Question from Jane about private diagnosis of autism. The NHS this is a difficult one, because the NHS is very sensitive about private therapists. And this is where, there's no easy answer here, because private therapists are sometimes the only people that will provide parents with advice, but often those private therapists' advice is dismissed by local authorities, your NHS, etc. There isn't an easy answer to this, unfortunately. Personally, I don't see why a private diagnosis is any different, but this is something that I think the NHS hasn't quite got to grips with yet, is how does that private versus NHS work? And that it goes back to the joint working. They need to figure out how they work with the private therapists, because private therapists themselves all have to be monitored by their own membership groups. They may not be the same membership groups that the NHS therapists work within, but often what you'll find is it's NHS therapists that often do private as well. So there is a bit of a tension there, and nobody's figured it out yet, basically. Okay, and another question from David about what is the function of a clinical senate? I haven't mentioned clinical senates in this, and my understanding of clinical senates is they are basically those expert advisory panels that are there for clinical commissioning groups to go to when they need to ask questions around whether or not they commission something. So if they're looking at changing a commissioning or looking at bringing in something new, the clinical senates are the expert advisory panels for CCGs. CCGs are kind of in the same way as GPs can't be expected to know everything about everything, neither can CCGs, and the clinical senates are the experts that help them out that way. Last question from Jane: how do we argue the case for us to be involved in PPI when meetings are held outside of school days and focus on the elderly? Not uncommon. I'm making an assumption here that this is something to do with Health Watch, potentially, because I haven't really mentioned Health Watch, which is another organisation there that is supposed to be that consumer champion for patients of the NHS. Because of the way it developed and because of the organisation that predated Health Watch, there does tend to be a focus on elderly care. It's because the people that are involved in it, they're often the elderly and retired, and that's kind of historical, and it is quite difficult to get involved in that when you're being excluded because all the meetings are being held at times that you can't do. There are some good examples of forums working with Health Watch, although there are also equally as many where forums don't get any involvement with Health Watch. I would, in answer to your question, Jane, I think it is just about keep modelling the same. You've got to keep telling them over and over again. It's the same as how we started with local authorities. We had to keep telling them, you can't have your meetings outside of school hours. You've got to be able to include parent carers in the discussions. And the same goes for this. And if you look at some of the guidance around NHS engagement, it all says this. So it's not rocket science. They know that Health Watch particularly are mostly unaware that they should be representing children with disabilities, and as is common, I would say, for the majority of society, most people don't know children with disabilities exist. So it's about raising their awareness, pointing out to them that they need to be representing children with disabilities too, as well as the whole children's population. But historically, they haven't. I hope that answers your question, Jane. Okay, I've got one more question, and then I'm going to... this is no, not Health Watch. This is groups directly through the CCG. They should know better. I would go back to have a look on the website for the NHS England guidance for CCGs about engaging, and take that along to your CCG and ask them how they are engaging with everyone, not just the elderly. Finding evidence. So this is about supporting your case. You've got all your parent feedback and you've got it themed, and you've pointed out what the problems are. How can you back that up? It's, again, evidence is so important to the NHS, and unfortunately, in order to get them to listen, you need to have that evidence yourself. Not only you've got the evidence from parent feedback, but if you can back it up, it's even better. So this is, again, about what are those levers that you can use in order to encourage people to engage with you. NICE guidelines is a good place to start. They're often statutory, i.e. they must be followed. Things like the Royal College of Paediatrics quality standards and the British Academy for Childhood Disability Standards, they're not statutory, but if they're members, they should follow them. So there's still a should there, and it gives you that little bit of extra leverage to say, well, this is what the quality standards say, how are we working towards it? A good example is transition. There is NICE guidelines around transition that says that transition to adult services should not be based on an arbitrary age. But we all know that that doesn't necessarily happen, but that's what the NICE guidelines say. So that is what people should be working towards. And if there's a specific treatment or service, look up best practice. The What Works website that we talked about before, the NICE evidence search that we talked about before, but also there are lots of other royal colleges. There's the Royal College of Speech and Language Therapy, the Royal College of Occupational Therapy, Royal College of GPs. There's lots of them, and most of those royal colleges will, if there are debates within the area, it will be the Royal College that makes that decision about this is what we're telling our members to do. So it's again useful to look at what are the Royal Colleges saying, what are the Royal Colleges telling their members to do. Excuse me, there we go. That feels like a huge amount of information in a very short space of time. So, and that's nearly the hour up. So have you got any other last minute questions? I will just hold on for a moment in case anybody is frantically typing. And just as a reminder, the presentation will be loaded alongside the recording of the webinar. And hopefully all of the links that I've included in the presentation work. But if you've got any other queries, questions, want to ask me something, want me to get involved anywhere, get in touch with either me directly or your parent care participation advisor. And I think we've answered all of the questions as we've gone along. And look at that, it's 1 o'clock on the dot. So thank you very much for listening, and hope you'll be in touch soon.